is Congresswoman Helen Tan, the head of the House Committee on Health. Good morning, Congresswoman, and thank you very much for joining us on the program.
Hi, Christian. Good morning.
Good morning. So will there be a House hearing as to whether ivermectin actually works and can be administered to treat COVID-19 patients?
Actually, last Tuesday, that was Holy Tuesday, when we conducted a hearing on the COVID-19 situation. And part of that hearing was a discussion on the ivermectin. So we've invited experts, medical experts from our country, and those who are pushing for the use of this ivermectin. We've also invited WHO to hear their position. And it's very clear there on their statement that currently the data doesn't show any benefit on our fight against COVID-19. So it cannot be used as a form of prevention and treatment. More or less when we resume on May, when the resolution of Representative Pineda and Representative Defensor referred to my committee, then probably we'll have another committee hearing on this matter.
In your case, how do you say ivermectin? Are you also convinced that this can work?
Of
that
course
this should
not.
be given a chance?
Yeah, of course not. Currently, I'm a medical doctor and I adhere on our mantra that first do no harm. Very clear on the statement of our experts. WHO itself has a pool of experts representing experts around the world. So I think we can base our decision on what they said, on their stand. So I think what we need is to give a little more time and wait for the result of the parallel studies. There are 13 ongoing studies according to them, and let's wait for the validation or the result of these studies. I'm so sad on what's happening right now that many are using ivermectin even without the clear benefit, although there are testimonials. But of course, we need to validate testimonials. Medicine is evidence-based. It's not based on testimony or opinion. So I'm just afraid of the safety of our countrymen who are using ivermectin right now.
And it's quite unfortunate that the encouragement is also coming from some of your colleagues, despite the guidance or the statements coming from the real experts, the WHO, the DOH, Merck itself, the manufacturer of the drug.
Yeah, I was saddened last night when somebody sent me a post from social media. You presented that earlier, and I asked FDA what could be their action on that, because it's very, I feel that it's dangerous. Social media is very accessible to everyone, and saying that or encouraging that they can just take it without the license of FDA. I think that's quite dangerous. I know we're desperate for solutions on COVID-19, but we should not be short-sighted on what's happening right now.
But by conducting, is this forthcoming another hearing that would also cover ivermectin?
Yeah, we'll have another hearing probably
May.
On May, or it will depend on the upcoming developments. As long as we get another reports or development from our concerned agencies, then we'll hold another meeting.
Now, by conducting another hearing about ivermectin, don't you think that would provide an unnecessary platform for these people promoting it, despite the guidance from the real experts? Provide them with yet another platform to convince people to take this medicine against COVID-19, despite warnings from the experts, and that it might inadvertently convince people that this might actually work, again, despite the reminder coming from the experts, from the government itself.
Well, I think that's part of our function. We do have that oversight function in Congress. I don't want to see it as it will encourage people to use, but actually it's a venue for people to hear from our experts what's actually real and what's not real. So it's very important that we play our role, especially in this situation that people are confused. What to believe and what not to believe. So I still believe that we have that important role to play in this matter.
Would you prefer that your colleagues go easy on their promotion of the ivermectin in the meantime until the studies are completed, and that perhaps, if indeed it could work, perhaps that would be the time for them to promote that?
Well, that's my appeal to my colleagues. If they're using it, they can use it at their own risk. But encouraging people to use it without any basis is again, I want to reiterate that I find it very dangerous, especially using social media.
Okay. Now, another interesting thing here is that based on the latest Pulse Asia survey, 61% of Filipinos surveyed were unwilling to be vaccinated for COVID-19. So you sense a lot of hesitancy from the population as far as vaccination is concerned, despite the actual findings regarding the efficacy of vaccines in general, right? But in the meantime, how come there are people who are very much willing to risk their lives to take a medicine that was intended for something else to be used for COVID-19? I mean, how do you, as a doctor, let's say dealing with public health, how do you make sense of that?
Actually, we're seeing the effect of that controversy on Dengvaxia, wherein there were issues on the death because of those because of Dengvaxia vaccine. So I think it's something that DOH should resolve, explaining it to people that this is a different story, and then we need to have a closure on that issue on Dengvaxia. I think the apprehensions of people emanated from that happenings several years ago, and I think there's no closure on that issue as of the moment. As to the medicine, taking medicine because it's easy to access, you can just get it over the counter, or they can just acquire from another person. Maybe that's the reason why they can easily grab or use that ivermectin as a form of treatment or prevention to COVID-19. So ivermectin is new. No controversies yet on the use of that ivermectin. That might be the reason why some people are being encouraged to use that.
Okay, Congresswoman Helen Tan, thank you very much for joining us on the program.
Thank you so much, and good morning, Christian.
Good morning.